Welcome. Let's meet our new chairman of Indian Board of Prosthodontics. Let's hear it from him. What is this Indian Board of Prosthodontics?
Hello, everyone. I'm Dr. Anand Krishna. Just a few minutes ago, I've been honored with the post of the chairman of Indian Board of Prosthodontics. Indian Board of Prosthodontics is a premier board of prosthodontists, which began in 2012. The idea of the founders was that there has to be some kind of board certification to evaluate a prosthodontist who is par excellence. There are close to about 500, 600 prosthodontists who are passing out every year. How will you evaluate who is the better ones? Is something that was the idea. So they set up this particular board. In the medical sector, you would have heard as board certified endocrinologist or board certified orthopedician and things like that. On the similar lines, Indian Board of Prosthodontists was formed to evaluate prosthodontists, and those who certify or those who kind of meet the criteria, to call them as the diplomates of Indian Board of Prosthodontists or board certified prosthodontists by the Indian Board of Prosthodontics. That was the idea.
Okay. Now, the question that comes in everybody's mind is a new postgraduate just completed their post graduation in prosthodontics. What is the need for them to take up this kind of a certification process? Because it involves a lot of effort from their side also. Why you think they should take up this kind of a evaluation process?
So if you look at the population who come into BDS and then go on to do MDS, there is a drive for each and every person coming in to be excellent in their own fields.
Exactly.
Passion is something that is a part and parcel of every single person who is going to come in and do their MDS, right? Because even MDS, Master of Dental Surgery, is a very difficult training period for anybody. Okay. And when they're doing this, it is out of passion. It is not because they've just come here. It's not like a art or science course or something like that. It is a very rigorous training that they undergo. And the innate kind of makeup of this individual is to excel.
Exactly.
Right? And he wants to differentiate himself. He wants to be cut above the rest. Kind of mindset is what they come out with. So if you're looking at,
So it is not for everybody. That means only for few who wanted to excel, or how do it?
everybody wants to excel, okay? Whether you're ready to commit that kind of time, the kind of effort, whether you have it in you to actually go through and prove to the rest of the world, or to prove it to yourself,
Okay.
that you are a cut above the rest.
Okay, listen to that. You have to prove to yourself. That is the watchword Acharya would say. Now, somebody has decided by seeing you or getting motivated by somebody. What is the process of getting into this kind of a certification?
The process is very simple. It is a two-part examination, and the examination with part one, as it is called, is a multiple choice questions.
Okay.
It comes up with simple 200 MCQ questions, mostly in applied prosthodontics or in dental materials or related subjects. Nothing very, very academic or anything. It's not research oriented. Here you're trying to make sure it is clinicians who are coming in and taking up this examination. So it is going to be clinically relevant and clinically based examination. So part one will be 200 MCQ questions. Once you clear that, part two is a clinical based examination where you have to document 8 cases only and present it before the board and defend these cases. That is all what is there.
Now, how easy or how difficult is the process? Though you are saying it for 5 minutes, So, is it a easy process for somebody who is new to get into this kind of a certification process?
So somebody new will never get into the process of certification.
Uh,
They're all prosthodontists. There is a global standard for you to be called as a prosthodontist or a prosthetic specialist. Okay. And this is something that is being evaluated. If you say that, look, I've become a prosthodontist, but I don't even know how a camera looks or how to operate a camera, or I don't know how to take a photograph, then it is very difficult for you. If you're a well trained prosthodontist and you've already gone through the training, it's just a cakewalk. Because each and every case that you're going to do, of course, there are 8 different varieties of cases, but it is not something which is very difficult or out of syllabus.
that brings me to ask another question. How easy or how difficult the exam was? That is, basically, everybody is aware of the clinical cases that needs to be submitted. Everybody is little reluctant to appear for the part 2 exam, which is actually the case discussion exam. What is your thought process?
So, if you ask me, it's not case scenarios. 8 case scenarios. I mean, in the sense, it is not 8 case scenarios that you have to exhibit. It is 8 different opportunities that you have to exhibit your talent. It might be a simple complete denture case, but you can say, I have improvised, I've used SPA factors to select the tooth form, I have done Rugal forms, I've incorporated that, I have made balancing, I've made something else. So there are many ways to improvise your own work, is what we are looking for. 8 different opportunities for you to exhibit your knowledge and your talent.
Like a cricketer, you are talking, that is, you have to enjoy the pressure of being an examiner and exam.
Absolutely.
Is that what you are thinking about it? So nice of you. And one final thing which I wanted to ask you is, what is that you are envisioning down the lane, 10-year down the lane, from the board? What is that you are envisioning?
So first of all, we want more participation in the board. It is, as I told you, it is not kind of a degree or something that they want to gain. Yes, it is board certified. You'll get a lot of laurels. It is an opportunity for you to exhibit on your visiting card. Put it on your board and things like that. But it is also about self improvement. You know, self improvement is the most difficult opportunity that you will get ever in your lives. Right? How will you improve yourself, and how will you kind of get into the discipline of treating a case which is of international standard? That is what board certification brings you to. Moment you become a board certified prosthodontist, you're looked upon as best in this particular field, and you will also get into that groove where your documenting, your treatment planning will improve, you're kind of following up the cases with so much more attention to detail than what you would have if you had not even attempted this particular examination. So what I envision with the board is more and more youngsters should actually come forward, take the board certification, and go into this disciplined way of documentation of cases and putting it across to a peer-reviewed panel and getting themselves certified. Of course, in the next phase of board certification, we want to explore the opportunity where we can kind of include other countries. Now we are only limited to India. Lot of our Southeast Asian partners, countries are looking up upon India, not only in dentistry, but in all parts of life, or all parts of
Including prosthodontics.
including prosthodontists, they look upon us. So this should be kind of a board which certifies not only prosthodontists in India, probably in Sri Lanka, in Nepal, in Bhutan, in Bangladesh, Malaysia, and the countries around. That is the vision of the board that I have. In 5 years' time, we should reach to at least one international destination.
That's wonderful talking to you. Hope this brings light on Indian Board of Prosthodontics. I think your word on self-development should reach everybody. I hope the board does really well under your leadership. Thank you.